project with Durham College is research-based. Research brings community agencies and experiences together under one roof, and this is what the region is all about. Research helps to expand knowledge and leverage evidence-based learning to build a better model of care for our clients.
Hi, my name is Kay Corbier, and I'm a full-time faculty member at Durham College in the School of Health and Community Services. I'm working as a co-researcher with Amanda Cappon on the research project Raising Resilient Families. So this project, for me, the way that it is designed is really exciting because we use a co-production model and we directly incorporate the voices of people with developmental disabilities.
We have found that just in bringing a steering committee together with service providers, the collaborations with parents who have living experience, with some other key researchers in this field, we have already begun to see some changes threaded through the community that have increased and bolstered or improved supports for families with a parent with a cognitive challenge.
I'm 29 years old. I've had a lot of challenges throughout life. I've been in group homes, foster care. My father passed away when I was 15. I started living by myself at 16. I do have depression and stuff like that. Everything that goes on is impacts me up to this day, being in the system, being abused and everything, and I try to keep it away from my kids. I have a girl named Soraya, she's 6 years old, and I do have a boy named Elijah, he's 4 years old. I've always tried to do my best I can for my kids. I deal with that. Vicky, she helps me out with that. She helps me cope with understanding the kids, how to deal with the kids, how to basically not yell at the kids, even if I'm overwhelmed.
So this is a 3-year collaboration with Durham College and the Region of Durham. Starfish Parent Support Program has been dedicated to providing support to parents with cognitive challenges to raise happy, healthy children for a number of years, as well as reducing implications of social issues such as stereotypes, impacts of institutionalization and trauma, and violations of human rights. We have proven over the years that parents with disabilities can parent very successfully.
Bibi is a young mom. She has 2 beautiful children. She's a newer Canadian and is trying to get her citizenship. She's also navigating all of the child services systems. She needs that support in order to just learn all of the skills necessary to raise her children the best that she can. They're very rambunctious but healthy, fun-loving children. They receive services such as housing support with their portable housing benefit, services from children's services, and family services.
Well, of course, we work really closely with the adult community support service workers because they provide supports to the parent. As time goes on, we work with families to develop healthy routines and habits, understand child development, sometimes manage some behavior.
I help my clients navigate systems. I advocate for them in helping them get all of their needs met on a very holistic basis. The impacts are huge because we get to see people, realize their potential, realize all of the services that are available to them to meet that potential and to ultimately live happy, satisfied lives.
We've been able for the last several years to provide a placement opportunity for students in either the social service worker program or the developmental services worker program.
My kids, they sometimes make me insane, but you know what? That's what kids do. And we have to cope with it because you know what? When they get older, we're gonna miss them. They're gonna leave us. We're gonna miss them for sure. When we actually realize that, oh my gosh, we should have done much better for our kids, it would be too late.
Bibi's very intense in everything that she does. So she loves intensely, she gets stressed intensely. She would give you the shirt off her back. Bibi, she's really quite remarkable.